If you're researching Medicare supplement plans and are trying to figure out which insurance company might be best, this video is for you, so stay tuned. Hi, I'm Matthew Clausen with MedigapSeminars.org. My agency is an independent insurance brokerage helping people with their Medicare and retirement decisions in 49 states. Sorry, Massachusetts, but you are the only state that we don't work in. If you do choose to work with us, we represent your best interest in helping you find the right Medicare plan and the right insurance company for your needs and your budget. And best of all, our services are free to you, the consumer. All you need to do is ask us for our help. As one of the country's premier independent insurance brokers specializing in Medicare, I see a lot of people get stuck in their research of Medicare choices. In this video, I'm going to go over one of the most common and most hazardous mistakes that I see people make when trying to research a Medicare supplement insurance company. This video is not about the different Medicare supplement plans. It is about selecting an insurance company, and it's meant to complement my other videos. The most popular include Medicare Explained, Medicare Supplement Plans Explained, Medicare Advantage Plans Explained, and Medicare Part D Explained, and others that detail various Medicare supplement plans. An easy way to find those videos on YouTube is to either subscribe to my channel or simply search the hashtag MedigapSeminars. In the meantime, grab a pen and paper and let's get started. As I started to construct about how to research Medicare supplement insurance companies, I thought over all the things that I've seen people do, the mistakes, and I realized two things. One is that what I want to share is simply too much information for one video. So I've divided the subject into 3 videos. This video is about the most common mistake that I see on a regular basis, and it's the one mistake that often results in people making a poor decision. So I'm going to show you that mistake and then show you exactly what you should do instead. A second video is on the rest of how not to research a Medicare supplement insurance company. It may sound strange, but most people waste a lot of time and energy on the aspects of a company that are just not relevant to Medicare. And then a third, which walks you through what characteristics of a Medicare supplement insurance company are worth your time and effort as you make your decisions. Now, keep in mind, for my clients, I do this for you. I've been in this finance industry since 1984 and I have a background as a research analyst. I know these companies, I know their pricing habits and their strategies, and when you speak with my office, you're getting my recommendations. You do not have to become a financial analyst or an insurance broker to make the right decisions with Medicare. You just need to have one like ourselves working for you. And of course, my services are free to you, the consumer. It costs you nothing to get the benefit of my knowledge and my experience, and that's a win-win. So what is this one biggest mistake that is so important that I decided to make a separate video specifically on this subject? Strangely enough, it's a problem that started with a court case back in the 1990s. Unlike the younger generation, many of us remember when public access to the internet was new. In the early 1990s, the public internet was still getting its footing. There was an insurance company that decided to create a website to promote complaints about insurance companies. Its business model was to publish every bad comment that they could find and then charge the insurance company to clean it up. Of course, insurance companies sued to shut down the website, arguing it was nothing more than extortion. The courts, however, were very concerned about stifling free speech on the internet at that time, and so they ruled as long as the comments were real comments from real people, the website could continue to operate, even if the comments or complaints weren't relevant. So fast forward to today, almost 30 years later, and managing a social media on the internet, that presence is more important than ever to any company. But for the consumer, there are traps. There are websites that are designed to make it look like they're trying to do you a service when that's not who they're serving. For most of us, when we want to research something today, we'll either go to YouTube and search for the subject or Google it. When people Google insurance company ratings, they often end up on this page or a page like this, Consumer Affairs. Consumer Affairs, if your first impression was to think it's like Consumer Reports, well, that may be intentional, but it's not correct. I'll show you the difference in a moment. The first thing to note is that Consumer Affairs is a .com website. .com stands for commercial business. But when you look, there's nothing to buy and no advertisements. How does a .com website like this make money? To their credit, the answer to that question is now right on the top of the front page. It didn't used to be that way. In fact, when I first started the idea of making a video about this, I had to dig deep into this site to find the truth. It may be that some of the more recent lawsuits have encouraged sites like this to be more upfront and to change how they go about their business model. But I'm getting ahead of myself. Let's click on this link and take a quick look at the site's business model and see why this is so important to you. So what is their business model? Let's see how they make money. So how do we make money? We offer our website for free to the consumers. We make our money with our Authorized Partner Program. We have an Authorized Partner Program for businesses who in turn pay us to participate. Those who participate are our authorized partners. We may earn money from certain businesses when you interact with them through our website, such as clicking on a link from our website or filling out a form on our website and calling a number from our website. And when you make a purchase, of course, in connection with such interaction. Now that's very interesting. So they are also an affiliate site where they get kickbacks on some of the products. And they can't on Medicare supplement insurance, but they also now cover other industries. What you should note is this site is not for the consumer. Its business model has nothing to do with benefiting the consumer. It generates income by convincing businesses to pay a fee to clean up complaints. The customer is the insurance company or corporation. Consumer complaints are just a tool to convince a company to pay a subscription fee to manage their online presence. Now, before I continue it, I'd like to ask that if you do like this video, by the way, or if you found anything helpful so far, please do also click our like button, and please also subscribe if you'd like more videos. So I too need to manage my internet presence, and when you do like and share this video or comment, it does help us out. So where were we? Remember the lawsuit I mentioned from the 1990s? Well, there have been others, and here's one from Consumer Cellular that accuses them of intentionally subverting positive reviews for the corporations that don't pay their subscription fee. And there are others. I'll leave it up to you to read this lawsuit and this complaint and the findings and the appeals. I don't want to be accused of misquoting a legal finding. But I do want to stress a few things that are critical in reference to your Medicare decisions. First, even if all the comments in this site and others like it are true, which is questionable, that does not mean they're relevant. Many have nothing to do with health insurance, let alone Medicare. So what is relevant or not relevant? Well, let's start with the goal of the research. If you're researching to find out about the benefits or claims paying history of a Medicare supplement insurance company, you're missing the most important piece of the puzzle. That piece of the puzzle is simply this. When you have a Medicare supplement plan, Medicare, the government agency, is your primary insurer. Medicare makes all the decisions on claims. The Medicare supplement insurance company has no say in what is covered or who gets paid or how much or when. Medicare dictates all of that. In fact, your healthcare provider does not even bill your supplement company. They bill Medicare. Medicare then tells the insurance company what to pay, when, and so on. Medicare's intent is to cover all medically necessary treatments. If it's medically necessary, Medicare's intent is to cover it. And they rely on your doctor to help determine medical necessity. When you have original Medicare, your benefits and claims experience is going to be the exact same no matter which insurance company you use. It doesn't matter if you have the best or the worst insurance company managing your supplement plan. That's part of what makes Medicare supplement plans so attractive. The insurance company has no say in your health care. They have no decision-making authority. All they do is pay your provider. There are other sites whose business models and intents are very similar to consumer affairs. Pissed off consumers is another one I hear often, and I'm sure there are others. If you're going to use one of these sites for your research, well, caveat emptor, or if you prefer the modern version of that saying, you can't believe everything you read on the internet. So let's compare what we just saw with Consumer Reports. So here's the About Us, support our work. Consumer Reports is funded by subscriptions and donations from consumers, not from the organizations they're supposedly rating. I hope the difference to you is self-evident. Consumer Reports is a nonprofit that serves the consumer. Consumer Affairs is a for-profit that profits off of the consumers, or more precisely, uses the consumer to generate profits from corporations. So I'm not suggesting that you use Consumer Reports to analyze insurance companies. I have a much better solution for you that I'm going to illustrate in just a moment. But first, I need to make one other brief point, and that point has to do with star ratings. Often, one of the first indications I have that someone has been searching through sites like Consumer Affairs and has a tainted view of an insurance company is when they respond to my recommendation by saying something like, that insurance company only has a 1-star or a 2-star rating. Why would you recommend it? First, Medicare is the only organization that can create legitimate star ratings for Medicare plans. No other organization's star ratings are considered valid, and they can't be used or promoted or illustrated by any Medicare agent. Second, Medicare supplement plans don't have a star rating. Only Medicare Advantage plans and Medicare Part D prescription drug plans have star ratings. Why this is the case is the most important point that you need to understand. The reason the Medicare Advantage plans and Part D plans have star ratings is because the insurance company managing these plans has a say in what is or is not covered. Because the insurance company can have a say on what is or is not covered, each consumer, also known as a Medicare beneficiary, can have an experience that's different from another person on the same plan. You and your neighbor can have the exact same Medicare Advantage plan or Part D prescription drug plan and have a totally different experience. The insurance company may deny coverage for a procedure your neighbor needs, but not you. They may deny your appeal for a medication, but not your neighbor. The star rating was created to provide you a way to measure the average performance of an Advantage plan or Part D plan for the consumer. This is what Medicare wrote regarding their star ratings. The Centers for Medicare and Medicaid Services, CMS, publishes the Medicare Part C and Part D star ratings each year to measure the quality of the health and drug services received by the beneficiaries enrolled in Medicare Advantage and prescription drug plans. The star rating also reflects the experience of the beneficiaries and assists beneficiaries in finding the best plan for them. The star rating is supported by CMS efforts to put the patient first in all of our programs. An important component of this effort is to provide Medicare beneficiaries and their family members with meaningful information about quality and cost to assist them in being informed and being active healthcare consumers. So Medicare prescription drug plans and Advantage plans are rated on up to 45 unique quality and performance measures. So Medicare Advantage prescription drug, they're rated up to 33 standalone PDP and et cetera. So each year, CMS conducts a comprehensive review of these measures, and it makes up the star rating by assessing the reliability of the data. So as we read this, and I can keep reading this for you, but the bottom line here, and the reason I wanted to read this for you is to show you that the star ratings are not just an arbitrary complaint fest as it is on the other ratings. So let me answer the questions that should be on your mind. And that is, why is it that Medicare supplement plans do not have a star rating? The answer is because the insurance company has no say in your benefit coverage. Your experience with a Medicare supplement plan is your experience with Medicare, and because that doesn't change from one plan or one insurance company to another, there's no need to create a measure of the average performance. Medicare would be, in essence, rating themselves, and all the supplement plans and insurance companies would have the same rating. It'd be kind of silly for Medicare to just give itself a 5-star rating on all the supplement plans. Another way to put it is, if you and your neighbor both have a Medicare supplement plans, even if it's from a different insurance company, there would be no difference between your experience with Medicare and your neighbor's. So for the last part of this video, I want to show you where I would go to look up the Medicare supplement insurance company complaint history. Keep in mind, I still view it as a moot point when it comes to Medicare supplements, but it can be important for other types of insurance policies, including Medicare Advantage plans. And although Medicare itself and many insurance companies are national entities, insurance is managed by the state. And each state has an insurance commissioner whose office regulates insurance programs, including the licensing, prices, benefits, and helps consumers with legitimate complaints. With 50 states, there are 50 state insurance commissioners, and then to better share this information, they've created an association called the National Association of Insurance Commissioners. Now you can find them on a website, the NAIC.org, so let's take a look. Obviously, there's a lot here. If you're interested, I suggest reading the About section. For us, let's go to the consumer. We're going to go down to the consumer insurance search, where it says we can find information about insurance company complaints and so on. This is where it gets a little tricky. If you want to search for a company, you must have the official name of the insurance company for that state. And I scroll down to the company that I'm looking for. So I'm going to illustrate using United Healthcare because it's an easy one to get wrong. Most of you may recognize United Healthcare as the company that is contracted with AARP. I believe AARP pays them 5% of the revenues to be able to use the AARP name, and AARP is not an insurance company. So if I plug in United Healthcare in Florida, I get a legitimate result, but none of the complaints are logged. We see nothing. So if you get no results, then you need to check the name. And I like, in this case, matching the website. I already have the group number, so we're going to go to that, 79413. And this is displaying the complaints filed in 2020. You can see the type of coverage, reason for the complaint. You can see how some of this may be helpful if you're getting an under 65 insurance plan or a Medicare Advantage plan. You can even see if providers complained, which is interesting. But for anyone who likes statistics, this is fun to play with. Now keep in mind, in every case that you look at, the number of complaints or issues with Medicare supplements are minuscule relative to the number of policies sold. And a complaint does not mean that the insurance company did anything wrong. In fact, you can look at dispositions and find out how often the state insurance commissioner's office upheld or overturned the insurance company position. But I wanted to stress this is not all you need, and it's certainly not all I look at when making a recommendation. There's much more required to make a sound decision. Still, if you're going to research all of this, at least use the right tool. Again, that is what we do, and I use over 3 decades of experience and training as an analyst to help make my recommendations. And my goal is to get you with the insurance company that I believe will have the most stable price experience. I don't like surprises, and I don't want my clients to have surprises. What we want is the lowest price over your lifetime. I'm Matthew Clausen with MedigapSeminars.org. Thank you for watching.